Hello, everyone. It's Friday, September the 2nd. I hope and pray that, everyone will have a wonderful, wonderful Labor Day weekend. We'll get to that in just a few moments, but for a lot of families, we've lost another 20 people in West Virginia. We're up to 7,294 deaths in the state of West Virginia. A lot of folks here are probably not going to have a great Labor Day weekend. So nevertheless, please, don't let them feel alone. Just reach out, offer up your prayers. But the 7,275th death in West Virginia is a 95-year-old female from Hancock County. The 7,276th death is a 63-year-old male from Berkeley County. The 7,277th death, a 58-year-old female from Taylor County. The 7,278th death, a 70-year-old male from Kanawha County. The 7,279th death is an 83-year-old male from Kanawha County. The 7,280th death is a 63-year-old female from Harrison County. The 7,281st death, is a 38-year-old male from Kanawha County. The 7,282nd death is a 67-year-old female from Kanawha County. The 7,283rd death is an 87-year-old male from Preston County. The 7,284th death is a 61-year-old female from Kanawha County. The 7,285th death is an 89-year-old male from Cabell County. The 7,286th death is an 83-year-old male from Summers County. The 7,287th death is a 79-year-old male from Wayne County. The 7,288th death is a 95-year-old male from Ohio County. The 7,289th death is a 71-year-old female from Putnam County. The 7,290th death, a 94-year-old female from Marion County. The 7,291st death is a 92-year-old female from Hancock County. The 7,292nd death is a 97-year-old female from Cabell County. The 7,293rd death is a 57-year-old male from McDowell County. And the 7,294th death in West Virginia is a 91-year-old female from Hancock County. Please don't forget them. So much wisdom gone. This is really tough too. We know how much we depend on our coal miners in West Virginia. We know how much our nation and the world has depended upon our coal miners in West Virginia. We know what it meant in World War I, World War II, the other wars. Absolutely, without any question whatsoever, our coal miners in West Virginia saved us in every way. We've just lost another absolutely wonderful coal miner, but a wonderful young man. 34-year-old Christopher Ball from Hart, West Virginia, was fatally injured on Thursday evening at the Black Hawk mining operation at Coalberg Tunnel Mine. It's located in Kanawha County. I could never say enough because I am very, very familiar with coal mining, all the miners across our great state, the work that they do every day. Every single day they leave their family, and it's tough. It's tough work. They're absolute heroes. We try to be as safe as we can possibly be all the time. I'm sure that we try to stress safety over and over and over. But it's a tough occupation, and we should be so eternally grateful to this young man, his incredible family, and absolutely to all of our coal miners across the state. It's a tough time, and I'll promise you that Kathy and I have already, but we will continue to keep this young man, Christopher Ball, and all of his loved ones and all of his family in our prayers. And I ask that you'll do the same. Okay, from the standpoint of our Omicron booster shot, yesterday the CDC approved and updated the Omicron booster shot for individuals 12 and older. this basically comes at a critical time when kids are getting ready to go back to school, and absolutely, you know, this could really help, and we really need to pay close attention to this and everything, and try to take advantage of it if you would. I'll promise you this thing's not gone. We just read another 20 names today, and absolutely, but at the same time, we're finding ways to live with it. We're very, very hopeful of the plateau that is absolutely looking like it's going to move to West Virginia as it's happening in different parts of our country right now. You know, when these Omicron booster shots get here and all that kind of stuff, we'll start doing exactly as we've done before. You know, we'll start, you know, when they start arriving in West Virginia and we start administering them, we'll begin that immediately. But the way we'll do it is the way we've done it before in the past. Our 65 and older folks, you know, will come first, and then we'll move through our population. But we continue to strongly recommend that you get these booster shots. And I think General Hoyer has a message for us today. And maybe, Jordan, if you could play that now.
Good afternoon. Governor, I apologize for not being able to be here in person on the press conference, but did want to provide this recording to update citizens on a couple of key areas. First, related to hospital numbers. Our hospital numbers have dropped below 300 at 282, so that is a positive sign and positive movement in the right direction. And again, if we have potential surges after the Labor Day holiday, we'll have relieved some level of pressure on our healthcare workers and our hospitals. Also, vaccines numbers still continue to move forward. In the last two reporting periods, a total of 313 West Virginians have gone out, over the age of 18, have gone out and received their first dose of vaccine. So West Virginians are still going out and getting vaccinated. That will be particularly important as I talk through these other points, because anyone who wants to get the COVID-19 Omicron booster, which is the current booster now approved for those over the age of 12, will have to have had the primary series, meaning either the first two doses of Pfizer and Moderna or a dose of the Novavax vaccine. They'll have to have those before you can get the booster, and the guidance is 2 months after that primary series, or if you've had the first and second booster, 2 months after your most recent other booster. I realize that is confusing, but again, right now, West Virginians over the age of 65 and in long-term care facilities are our primary focus as directed by the governor. Then we will begin to work with and continue to make available for those over the age of 50, and then for the rest of West Virginians is our priority, particularly healthcare workers and those who work in and around folks in the medical community. But again, anyone over the age of 12 who has had the primary series is now eligible for the COVID-19 Omicron booster. Please understand that Omicron booster was approved last evening by the CDC after review by its committees. In addition to that, it is focused on both the original Wuhan variant as well as the most recent sub-variants, particularly BA4 and BA5, which now in our country make up over 90% of the cases that we see in the United States, and we are in the high 80s with BA4, BA5 variants in West Virginia. Those who are 6 months or older should continue to stay focused on again, that original sequence that is out there for vaccinations. We started receiving vaccines yesterday and continue to receive vaccines today. As mentioned before, our initial allocations were right around 50,000, 49,600, and we anticipate over the next couple of weeks a significant influx up to potentially 100,000 doses over the next week to 10 days. So we should not have any shortages of vaccines. As I record this this morning, it's my understanding that the CDC Vaccine.gov website has had some issues, so you may have some challenges getting on and finding locations. Again, the governor has pressed us not only to maintain our interagency task force, but all the components that go along with that, to include the vaccine hotline, and that hotline run by that team at DHHR. So if you have questions, you have concerns, reach out to the hotline. They will help you work through any challenges with confusion, help with identifying locations that are available for the Omicron booster that is now out and available. That hotline number is 1-833-734-0965. Again, West Virginians, I understand that this is quite confusing. The vaccine calculator is going through, the team is going through and working to update all these changes. Within the next 48 hours, it will be up online. So between the vaccine calculator, the hotline, working with your local providers, we will help you work through any confusion that you might have. Your local health department is also a very important resource for you. So again, any follow-ups needed, please reach out to those sources. And we thank all West Virginians to continuing to press forward to get vaccinated, either that first dose, as those 313 have shown us in the last 2 days, or those who now need to go out and get that Omicron, that COVID-19 Omicron booster. And again, particularly focus on the fact of what Dr. Marsh, the governor, have pointed out over the last several press briefings. West Virginians over the age of 50 are exceptionally vulnerable. We have lost, our percentages are 97% of the West Virginians we've lost are over the age of 50. 75% are over the age of 65. So it's really important for those groups to go out and get this COVID-19 Omicron booster. Thank you.
Jordan, are you back to me? Okay, thank you. I'm just making some notes on what General Hoyer was saying. You know, just following up on what he was saying real quick, you know, I really think that the net of the whole thing is as these Omicron booster shots are coming in, you know, yesterday and today, people pay really close attention. We're going to, like I said, start with the 65 and olders and work our way right on down. We're pleased to hear that, you know, the CDC has approved 12 and older, you know, for these vaccines as well. And you know, the last little note that I wrote down is just please take heed to the fact, you know, of how contagious and how absolutely how fast spreading and that the Omicron situation is today. So nevertheless, let me go back to the numbers. So, you know, the active cases are 3,362 in West Virginia. There's 996 new positive cases, you know, in the last 24 hours. 8.89 is our positivity daily rate. 8.49 is our cumulative rate. You know, just a little over 574,000 now have recovered from COVID. 282 hospitalized, like General Hoyer said, 41 in the ICU units, 11 on ventilators. We do have an Orange County now, so it's, you know, that's not great. In fact, that's not good at all. And I'm just looking, it looks like we've got 7 gold counties, and you can see what we're dealing with there. So nevertheless, please, just like I said, take heed to the fact that this thing's not over. And but we absolutely have a real mechanism to be able to live with it, and you know, just try to take advantage, or try to at least consider taking advantage. And I was really pleased to hear General Hoyer say that we picked up another 330 plus folks, for their first vaccine, and that's really, really good. And I always go back to just this, of those 330 plus people, how many of them could be a life saved? Really, when it really boils right down to it, how many? Pick a number, 6, 14, whatever it may be. If it's 1, then identify just this, what's that life worth? And you can't do it, and neither can I. But we can say this, if every day that we come and every day that we try, that we absolutely have the opportunity and a chance of saving a life, then we come, don't we? And that's what we should do. From the standpoint of the vaccine calculator, it's all up there, same, on our website, same is true for any information on COVID. It's all up on our websites. We have 115 outbreaks in our long-term care facilities, none in our church community. Our corrections, we have 137 inmate cases and 49 staff cases right now. The reason I'm going quickly, I've got a lot of stuff to go through here. We are rescinding an executive order, our COVID executive order today. I'm announcing that I have rescinded Executive Order 1321, which required testing at least twice a week for our healthcare workers not fully vaccinated against COVID. The Centers for Medicare and Medicaid Services have now a more complete and updated guidelines, and we're going to follow that. I remind you about the Homeowners Assistance Program. If you're a homeowner in the state of West Virginia and you're having some problems and they're COVID related and everything, give us a chance to get you qualified. We can maybe put some real money in your pocket if you'll give us a chance to get you qualified. I remind you about giving blood. Really, really, really important. Our revenue numbers are continuing to be great, and I could not possibly be more proud. That's just all there is to it. We have done exactly what you employed me to do, and that was mind the store, get our state right side up. I promised you a rocket ship ride, and you're on it, and absolutely our state continues to do terrific. We have another surplus, in the month of August of $141.8 million, it above our estimates and above budget. It puts us well over $200 million in 2 months, and that's not to think, that the last go round in the last 12 months we came in at $1.3 billion ahead of budget. Now, I've got just this to say, and I won't belabor this, and surely won't beat a dead horse on this, but I don't know why in the world the Senate won't act. We've got the surpluses. We've got the mechanism in place to be able to get real dollars right back in the pockets of hardworking West Virginians right now. I proposed a 10% tax cut, from the standpoint of the House of Representatives, our House of Delegates rather, they are right with me. I do not know why in the world we keep sitting on our hands. We've got people that are hurting and struggling with inflation like crazy, whether it be gas prices or food prices or whatever it may be. We've got the surpluses, and I ask you absolutely to reach out. Reach out to our senators. They're great people and everything, but reach out and tell them we've got to do this, and we got to do it right now. We can't keep trying to play politics to be able to get up on a soapbox and pass something and say, look what we did for you, elect me. I've told you over and over and over, like it or not like it, but I came here to do one thing, and that's to serve. I don't want anything. I never have wanted anything. And with all that being said, we need to pass this. We got too many people that are really hurting, and we need to step up and do the right thing. We're absolutely bogging down, hundreds and hundreds and hundreds of thousands of hardworking West Virginians because of the wishes of a very, very, very few. We got to stop this. We got to stop this. At the end of the day, our job here is to listen to the people and try to do the people's work. That's all there is to it. These are not our dollars. These are the people's dollars. And so we really, really, really need to get this passed and get on a pathway. In all honesty, you could argue all day long with me about a lot of things. I just met with the guy, one of the leading guys in the Federal Reserve. And the first thing he said to me, the very first thing he said to me was, your idea on getting rid of your personal income tax is so spot on, it's unbelievable. Now just stay with me just 1 second. His name, I think it's Tom Barkin, but nevertheless, we sat there and we talked for, for 30 or 40 minutes. He said, do you realize, just look around, it is proven and proven and proven and proven. Look what's going on naturally in Tennessee or Florida or Texas or wherever it may be. But do you realize that Georgia is on a pathway to doing this right now? South Carolina, which is a fabulous recruiter of businesses, on a pathway of doing this right now. In order to be able to compete, with other states, you got to get on this pathway. Now, you can come up with other ideas all day long, but this is the best one. This is the one that brings us real live growth. We're still the one that is positioned within a rock's throw of 2/3 of the population of this country. We're still the one that 2/3 of the population is going to have to drive through to get to a South Carolina or Georgia or Tennessee. We're still absolutely the one with 4 of the greatest seasons on the planet. If you want to drive growth, real live growth to West Virginia, we want to immediately help our folks that are out there that are struggling with inflation. We got to move. And absolutely, I'm trying every single way that I can possibly try to get the Senate to move. I have said over and over and over, I am willing to compromise on any and all kinds of points, but we got to move. And sitting on our hands is really, really not the right thing to be doing. Like I said, I got a bunch of announcements. The school board, we had 2 vacancies on the school board. I have now appointed Victor Gabriel and Dr. Chris Stansberry to those positions and everything. I can tell you both people are extremely qualified and everything. Victor is from Harrison County, and what an incredible amount of work that he's done. He's served on the board of the directors from the YMCA. He's taught in Harrison County for 15 years. He was appointed to the School Building Authority in 2010. He's got a resume that's second to none, a graduate of Fairmont State and West Virginia University. He resides in Bridgeport. Dr. Chris Stanley is a highly experienced eye doctor that a lot of us know in the Kanawha area. He practices right here in Charleston and everything. He served on the House of Delegates. He is a graduate of West Virginia University and the Southern College of Optometry. He's a Charleston resident and just a great man. And both these people, their heart's in the right spot, and they'll do a great job and everything. And our board president, Paul Hardesty, doing a wonderful job right now. We got David Roach, the superintendent. So many people that are in position right now to take us to another level and make things better and better. That's what we're trying to do. It's what we continue to do. Now this Hearthstone Holdings acquisition, this is just more and more and more good stuff coming to West Virginia on Wednesday. Hearthstone Holdings announced that it closed an acquisition of 100% of the equity interest in Hope Gas, and not only are they doing great work, in the gas industry, they're now bringing their headquarters to Morgantown, and not only are people extracting our resources and helping us with stuff like that, but now they're bringing their headquarters to Morgantown. So we thank them in every way. It's just another great, exciting announcement for the Morgantown or North Central West Virginia area, but it will be absolutely just really, really good stuff for all of us. So thank these people in every way. The Gauley season on the river opens, in 9 days. That's a really exciting time. 40,000 people flock to West Virginia to be able to go down to Gauley. It is an exciting time, and that will last from September the 9th to October the 15th. We welcome all those people, and we hope they have a fabulous time, be safe, and enjoy the beauty of this incredible state. It's just off the chart. Pure Watercraft at the Business Summit, I announced that they're coming to West Virginia. You know, this is an electric pontoon boat manufacturer, and they're coming, and you know, they're coming up in the northern part of the state, and we welcome them in every way. You know, they have chosen an 80,000 square foot production facility at Beach Bottom in Industrial Park, and they're going to revitalize this facility that's on the Ohio River. It just, you know, good stuff there. You know, I think General Motors bought a portion of their company and everything, so General Motors is involved, and it's just good stuff. We can't hardly keep up with all the announcements, but I'm gonna keep on going. I'm gonna get through them, you know, as fast as I can here. But the Lewisburg water announcement was a gigantic announcement. You know, the Lewisburg community continues to grow like crazy, and you know, of course, I know it ever so well. You know, I live there, and you know, but with all that being said, you know, if I'm not at the mansion, I'm there. You know, or somewhere in this state, all across the state. I don't go many places and everything other than all across our state, but I really believe being everywhere across this great state enables me to hear from the people and understand what really needs to be done, and I think we've been really successful at that. But this $52 million grant is really, really, really needed in the town and the community of Lewisburg, and so, you know, as this community continues to grow and everything, it's just a lot of great stuff happening there. You know, as we near the finish line on getting this water project going and everything, we're still incredibly grateful to a lot of different people, you know, to money that was contributed by the USDA. You know, the state stepped up in a great big way, but nevertheless, you know, very thankful to lots of folks and everything, and a great project there. You know, on Wednesday evening, you know, we left the business summit, and I went to Bluefield, and you know, there was a fundraiser going on in Bluefield, not a political fundraiser at all, but a fundraiser for Bluefield State University. Let me just tell you this Bluefield State is on the move like you can't imagine, and they're growing leaps and bounds, and they're bringing Bluefield State back to life in every way, and not only back to life in a big way. You know, this was, the fundraiser there was to kick off, you know, a fundraising effort to reestablish, and I say reestablish, their mining engineering program. You know, and, you know, programs like like these train the next generations of engineers that we need, and we need badly in the coal business. And from the standpoint of just that, let me just say that the town of Bluefield, or Bluefield State University, you know, in all fairness to them in every way, and I said this, they should have died. You know, when it really boiled right down to it, with the collapse of the coal industry, the moving out of the railroad, you know, from the standpoint of that community, it was likely one that probably couldn't make it. And the same for the university. What happened there? What happened? A lot of great people really dug in. A lot of people did exactly what I say all the time, pulled the rope together. You know, I've surely been a part of it, and I'm really proud to have been a part of it, but I give them so much credit. They have done so good. And that town of Bluefield, or Bluefield, Virginia, or Bluefield, West Virginia, together is really on the move. And Bluefield State University, really, really on the move. So Rob, you know, Senator Cole, all the different folks that really have played such a vital role in absolutely bringing this community back. You know, I thank the Pocahontas land folks and everything, and the NRP people that were doing this fundraiser. We absolutely should stand up for our coal miners in every way. I was really, really proud to be a part of it, and thank you for having me. And I thank Steve Sarver for inviting me. And but it was a really busy day on Wednesday, but we got it done. On Thursday, we went to the Monroe County courthouse and presented them a check for $5 million and everything to renovate an 1881 courthouse. Can you imagine this? For 3 years. For 3 years in Monroe County, West Virginia, we've had a non-functional courthouse. They've been in the bottom of the fire department, in the basement of the fire department. This beautiful facility here, since it's been there since 1881, is now going to get restored. And so I was really proud to go and be there and present the check, and now the work will begin, and we'll be back functional in Monroe County, and in a beautiful county beyond belief. And a lot of times counties like this are so far away from Charleston that a lot of folks in Charleston, we forget about them, but we're really, really proud that we got this going, and it's good stuff. And the last thing I've got is Labor Day. Labor Day coming on Monday, and we hope West Virginians all across this great state enjoy Labor Day and really take time to pause to just the meaning about really what Labor Day is all about. And be thankful, be so thankful for the labor, for the people that absolutely get up, grab their dinner buckets every day and go to work. Absolutely people that make us the state we are and the great people that we are every day. Now, but with all that being said, I want to challenge and tell everyone just this. Our state parks are really busy, and they couldn't be more beautiful. And absolutely, but I want to tell you that Twin Falls State Park, Capon, and North Bend State Park still have a few rooms, but imagine this. For all practical purposes, all the other state parks in the state are completely sold out. But literally, if you want a place to go as the fall progresses and everything, or the Labor Day weekend, we've only got 3 parks, but Twin Falls, Capon, and North Bend. But if you want great places to go that are very economical and just so welcoming and just so professional, look at our state parks. Couldn't be better. We remodeled those. We spent some real money in our state parks. Need to spend more. That's all there is to it. The more we spend there, the more we bring in. Just absolute ought to be automatic and everything. So nevertheless, I couldn't be more supportive and more thankful to Brett McMillian and Chelsea Ruby and all the great people that have put in the licks to make great stuff happen in West Virginia. I've tried to rush through it, and forgive me for rushing, but nevertheless, a lot of information. Thank you so much.
All right, thank you, Governor. Secretary Bill Crouch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
I'm sorry, everybody. I'm out here at this event on the East End. Governor, I want to go back to the state of emergency you declared on for corrections. Given the fact that we have another $140+ million in surplus in August, and Elaine Harris, who represents the Corrections Officers Union, she believes there's ARPA money that could be used to boost the salaries of our corrections officers and hire more. We have 742 vacancies in corrections of officers, 300+ support staff, so more than 1,000 vacancies in corrections. Do we need to call a special session of the legislature to address this, or can you spend ARPA money on it or some of the surplus money to give all those corrections officers a pay raise?
Mark, all of what you're saying is legit. The bottom line is it doesn't matter if we've got 600 vacancies, 700 vacancies, 1,000 vacancies. The bottom line is we can't attract them. We cannot get them if we don't have the offer of pay that would warrant people coming to those positions. So with all that, said and everything, we'll continue to look, at possibilities, whether it be special session, whether it be whatever the possibilities may be. But Mark, we're on it and we're working it and everything. But the bottom line, we really needed, and I don't know exactly if I'm going to say this exactly right, whether it be regional pay or whatever, but we needed that to have passed. We didn't pass it, So with all that being said, we've got some revisiting that need to be done right here, and we'll continue to prop up and everything and make sure that we're as safe as we can possibly be. But we got a real problem there. And the real problem is we've got to have the blessings to be able to move forward. But our people in corrections, to be able to track people, especially in the Eastern Panhandle, as expensive as it is maybe the cost of living there over maybe other places in West Virginia, we just can't get to people. And that's a real problem.
All right, thanks, Mark. Next to Charles Young with WV News.
Hi, y'all. This is Charles Young with WV News, and I apologize it's been asked and answered, but as General Hoyer said, this is a little bit confusing. So when will the general public be able to go into a pharmacy and get the new shots? I know they've been authorized for those 12 and up, but we're initially going to be focusing on the high priority groups. So just when can folks, healthy folks under 50 go and get this? Thank you.
Well, Charles, now, you know me, I always tell you the truth. From what I know, when that happens is when the pharmacies begin to receive, the Omicron doses and everything. Right now, as they're coming in and everything, we're going to, set up addressing the 65 and older, the nursing homes, whatever it may be, first and foremost. But, I wish General Hoyer could be with us because he could give us a whole lot more insight on that. And and we'll just have to wait until he comes back. But he just couldn't be with us today, so I can't give you more detail on that.
All right, thank you, Charles, and we'll get General Hoyer to get an update to you as soon as possible after this briefing's over. Final question today from Bob Aaron with WCHS.
Governor, 300 people getting the shot seems significant for them, but from a public health perspective, doesn't seem that significant. How will you all get, especially the people over 50 years old, to take this new booster in amounts that might stave off this fall surge?
Okay, Jordan, can you understand, Bob? I couldn't understand all of it.
Bob, try one more time. We'll turn you up in here.
How will you get people over 50 years old to take the booster shot in significant enough numbers to avoid a fall surge? You were just mentioning that 300 people got the initial shot. Well, that's certainly significant for them. From a public health standpoint, that number seems way too low to make much difference.
Okay, Bob, let me make a stab at it as best I can, okay? From the standpoint of 330 plus people getting a shot, you're dead on the money, right? We're really proud of the fact that 300 people got the shot, or 330 plus people got the shot. And from the standpoint of, if I had to come every 3 hours to get another 330 people to get their shot and ask people over and over and over to get vaccinated, I'd come. Because 330, like I said, we may very well saved a life or multiple lives. But with all that being said, from the standpoint of how do we really, really move the needle, from the standpoint of making sure that folks get their booster shots and and by the tune of what, General Hoyer just said a few minutes ago, that we moved to 100,000 in the first couple of weeks here, but how do we really get to that and everything? We've tried every gimmick known to man and everything, but what we got to do, Bob, is just be here. You've got to preach it. Everybody's got to preach it and everything and stay on course. What has happened here is just really simple. We got a lot of people that have gone to the sidelines, enjoying the beautiful weather and everything, and lo and behold, if we don't watch out, we're going to get some level of whiplash in the fall and get that surge back on us and everything, and then we'll end up losing more folks, and it won't be good. But I would just ask everybody to talk to your neighbors and talk to everyone and try to just do exactly what we've done over and over, and that's pull the rope together. I'll look at any type of incentive programs or whatever that we maybe could very well do, but Bob, at the end of the day, it's just a matter of really all of us reaching out and encouraging one another to get across the finish line, and that's what's done it already, but that's what we'll continue to do.
All right, thanks, Bob. Governor, I'll turn it back to you.
Okay. I guess one clarification that I need to make is, follow up on what General Hoyer said, is these Omicron booster shots that are coming out, and we got some in yesterday, we'll get more in today and everything, and it'll really amp up really, really quickly. We will very, very quickly, just to answer Charles' question even more, we will very, very quickly be in a situation to where anybody that wants to get one of these shots that is 12 and older will be able to get that shot, and that will happen, unless we stub our toes somewhere that I don't know about. Everyone really believes that the amount of supply will be here very, very, very quickly. And so with all that being said, all of us, 12 and older, all across the state ought to be getting ready to get your booster shot as soon as it gets here, and they will be here very soon. But the only thing with it, and this is a clarification from General Hoyer, is just simply just this. You've got to have had your primary series before you take the Omicron booster. So bottom line is just this, no matter what it was, whether it was, Pfizer or whatever, you have to have had your primary booster before you can get, or your primary series before you can get the Omicron booster. So with that being said, that's really, all I've got right now. I am really tickled to death that we picked up another 330 plus people, and I know that's not going to cause much of a wake in the pond, but it is 330 plus West Virginians, and that's really meaningful to all of us. So that's all I've got right now.